Shore Center for Mental Health Sciences. If they will come forward. As with the previous delegations, you will have 7 minutes to make a presentation, and at the end of 6 minutes, I will say 1 minute left. Don't stop talking because you have 1 more minute, but at 7 minutes, it's all over. So with that, we do ask that everyone identify themselves before they start speaking to make sure that we have the right name to the right presentation in our Hansard. So with that, the first is Nina Deeb.
My name is Nina Deeb. I've been a full-time realtor since 1996. And my recommendations on the budget are all housing related pretty much. So the first thing I would like to point out upon looking over the financial statements is the land transfer tax increases from 2019 to 2022. There's an increase in revenues to the province of $2.618 billion. Provincial sales tax on new homes, mortgage default insurance, and closing costs. There's a provincial increase in taxes of $1.738 billion. Personal income tax, capital gains, there's an increase here of over $4 billion. Corporations and capital gains, that's approximately $10 billion. What I'm looking for from the province, what I'm hoping that the province will bring forth and make available to the municipalities, I'm looking for $15 billion from the province that the province should download to the municipalities to make affordable housing available. So I heard what the mayor this morning said of Kingston, that they've invested $18 million. They could have, just with that money alone, they could have made 90 units available forever for the municipality. Just by now, waiving development charges is not going to help us get there because these costs are real. There's real costs to roads. There's real costs to bringing services out to new building and new subdivisions, and those costs should be paid by the developers. So I'm not looking for freebies, like as far as paying the way, but the province and municipalities do have a lot of land. Close to like over 80% of the land in Ontario is held by government. So we don't have a land shortage. The land could be made available in this situation. We need these units right away. So that's my recommendation on housing, and that's something that we could put to work right away to give us, if Canada Mortgage and Housing Corporation matches, which I think they should, that would give us $30 billion. We could have approximately 150,000 units available this year, and that's a plan that could really work. As far my next item of interest is the non-resident speculation tax from page 97. This tax should apply to apartment buildings. It should apply to residential units, 6 units and over. It should apply to agricultural land. I would like that exemption to be removed for these players. These players is what is driving our costs up on rentals, on rental costs for the people of Ontario. So that should be that exemption should be removed. I think. And also from page 150, the financial markets, the Bank of Canada raising its overnight rate. They've raised it 8 times since March 2022. What that means for the consumers, so right now, prime rate is at 6.7%. And this is an increase of 4.25% since last March, which that would take last February a payment on a $600,000 mortgage at 1.35%. That mortgage payment was at $2,026 a month. That mortgage payment now with the increase to the variable rate mortgages, that same mortgage now at a variable rate would be either 5.75% on a high ratio or 6.25% on a conventional. What this means to the payments of many of these new consumers in housing, this means that their payment went up almost $1,400 a month. So their payment now has gone to $3,424 a month. If you look at the way qualifying formulas work, this has actually created a reverse social economic formula on qualifying that could potentially and likely is consuming the entire income of the people that are in these mortgages. So this is forcing foreclosure within the actual formula, the way this formula is working. The Bank of Canada, we should have used monetary policy, but we should have used it in 2017. We shouldn't have waited to March of 2022. So the timing was very miscalibrated here. That's something that needs to be looked at. People are in very, very dire situation right now with where their mortgage payments are. These people can't afford that. They can't afford to be paying more than their entire income on these mortgages, and it's just benefiting finance. It's at the expense of the everyday. These aren't house flippers. House flippers don't take long-term mortgages. They take short-term, no penalty mortgages because they know they're flipping. These are everyday people living in these houses more than likely. And so that's one thing I wanted to point out. It's not sustainable. It's a 68% increase on these consumers. 50% of the mortgages in Canada are variable rate mortgages, and about 25% of mortgages come up for renewal each year. So it's affecting people that didn't even buy in that market. They're just coming up for renewal now, and they have these rates to contend with. They rose very high, and it's not sustainable for the people. The other thing I noticed is the MPAC new class properties. There's this new class of properties which takes taxes off one class and apportions it to the rest of the tax base. This shouldn't go on. Everyone should pay their own taxes. And the development charges on a whole, I'd like to speak on the development charges. Development charges pay for real costs, and we need the services. We need the infrastructure to have a subdivision grow, to have the services. We need transit. These are things that we really do need. We cannot be waiving development charges on properties like over $1 million. We need to be collecting these fees from these developers, and the municipalities need this money. So that's one thing that I think that we should leave the municipalities alone so that they can actually service. That's who's supplying the housing now. It's been downloaded to them since the 90s.
Thank you very much. That concludes your time. The next presenter is the United Steelworkers.
Thank you. My name is Brianna Broderick, and I'm Vice President of USW Local 2010 and 2010-1, representing approximately 1,500 support staff and academic assistants at Queen's University. I wanted to share some of the challenges that in particular my members, but more broadly, workers have faced over the last couple of years. Many of these issues could and should be addressed by a provincial budget structured to bolster supports for working families and provide robust public services. One of the biggest challenges my members are facing is the fallout from Bill 124. Bill 124, Protecting a Sustainable Public Sector for Future Generations Act 2019, and I've taken this right from the Legislative Assembly website, is to ensure that increases in public sector compensation reflect the fiscal situation of the province, are consistent with the principles of responsible fiscal management, and protect the sustainability of public services. Bill 124, of course, imposed a 3-year moderation period in which those workers affected could not receive total compensation increases in excess of 1%. So it's interesting to note that right in the foreword of the bill, it speaks to fiscal responsibility. This argument was roundly rejected by Justice Conan, and I'm probably going to mispronounce that justice's name throughout this whole presentation, when he ruled that the bill infringed on a worker's right to freedom of association and interferes with free collective bargaining. In his ruling, he wrote at paragraph 13, Ontario was not facing a situation in 2019 that justified an infringement on charter rights. In addition, unlike other cases that have upheld wage restraint legislation, Bill 124 set the wage cap at a rate below that which employees were obtaining in free collective bargaining negotiations. He went on to say at paragraph 289 that Ontario has not, however, explained why it was necessary to infringe on constitutional rights to impose wage restraints at a time it was providing tax cuts or license plate stickered refunds that were more than 10 times larger than the savings obtained from wage restraint measures. In addition, the inclusion of university workers and those in the long-term care sector could be interpreted as particularly punitive, as there is no rational connection between the restrictions imposed by Bill 24 and its stated purpose. These institutions have additional sources of revenue to fund wage increases. In fact, at paragraph 337, Justice Conan states, the fact that it may be more politically convenient to infringe on a charter right than to refuse additional funding to long-term care homes or universities does not, however, justify the infringement. If political convenience were the test, it would be far too easy to infringe on a charter right on a regular basis. Instead, what we saw was the weaponization of the legislative process, bolstered by the false narrative that Ontario was facing an economic crisis to target the government's perceived political opponents, the highly unionized public sector workers. The bottom line is that 124 has hurt workers. My members struggle with inflation and the rising cost of living. We were not able to negotiate the wage increases that our members would have needed to help alleviate. Now, don't get me wrong, it wouldn't have fixed inflation. Wages have not kept pace with inflation for as long as I've been alive, but it would have helped. Working people are struggling with buying food, paying rent, and affording basic necessities. And that has been compounded by a purposeful move of this government to use a false budgetary crisis to justify restricting their wage. We recently went with Unity Council, which is a meeting of the major unions on campus, and the president of PSAC 901, who represents TAs and postdoctoral fellows, reported that 70% of her bargaining unit accessed a food bank. At least 863,000 Ontarians in 571,000 households live in deep poverty. 12 years ago, I was a graduate student at Queen's. And while money was tight and budgeting was a challenge, neither I nor my friends used a food bank. If I were a student now, based on those numbers, it would be hard to have a friend that didn't access a food bank. The world has changed, but the funding packages have not, and graduate students can no longer afford to live and study, and neither were they able to bargain meaningful wage increases because of Bill 124. It is deplorable that the Ontario government would continue to pursue and commit more resources to the appeal of the Superior Court's ruling, which struck down this legislation. And in fact, Bill 124 wasn't the first time we saw the Ontario government use budget and imaginary economic crisis or deficit as a narrative. As of this morning, the Ontario Financial Accountability Office projects a budget deficit of $2.5 billion in 2022-23, significantly smaller than the government's deficit projection of $12.9 billion. With revenue growth projected to exceed program spending growth, the FAO projects a budget surplus of $1 billion in 2023-24, growing to $7.6 billion in 26-27. This discrepancy is significant. One must ask, why would the Ontario government report a significantly greater deficit than actually exists? What would the government gain from manufacturing an economic crisis? The Canadian Centre for Policy Alternatives published an article on November 15, 2022 by Sheila Block. In part, her article states, the government recorded a $2.1 billion surplus in the fiscal year 21-22, which ended in March. It is now predicting a $12.9 billion deficit for 22-23. That's a $15 billion deterioration in the province's bottom line at a time when inflation is driving revenue sky high. It is simply not a credible number. This doesn't add up. While high inflation rates are bad for many things, they are very, very good for tax revenues. And she goes on to write, let's not forget that this year's budget contains $5.3 billion contingency fund in addition to the ordinary $1 billion reserve finance ministers typically use. If some or all of that $3.5 billion remains unspent, the government has literally no plans to spend it. Ontario's surplus will be bigger than it was last year. It is obscene in an economic reality that sees higher cost of living, inflation driven by profit, and suppressed public wages that this government would consider privatization such as basic services such as healthcare and education. Asking workers to pay out of pocket for access to what should be basic human rights is unconscionable. The government should consider stopping their repeal of Bill 124 and introducing pro-worker elements such as paid sick days, such as the 10 paid federal days, adding processes which would make it easier for workers to join a union, as well as recognizing the damage that restricting wages have done to working families, and fully funding all public services, including the elimination of user fees and ending the introduction of private healthcare option and properly funding our public education system. Thank you, and I'd be happy to take questions.
Thank you very much. We now will go to the Ontario Shore Centre for the Mental Health Sciences.
Thank you so much, Mr. Chair and members of the Standing Committee. You have a one-pager excuse me, in front of you that can be used as a bit of a guide to some of the things that I'll talk about. And also, there's a photograph there that may also be of assistance. So to introduce myself, my name is Phil Klassen. I'm a psychiatrist and I'm Vice President of Medical Affairs at Ontario Shore Centre for Mental Health Sciences, which is one of 4 freestanding mental health facilities in the province of Ontario. It's an approximately 340-bed hospital that serves a variety of general psychiatry and subspecialty psychiatry needs. It has a mandate that goes beyond its region. We have a number of provincial programs, and it's a teaching hospital both with the University of Toronto and with Queen's University, and we have about 300 or 400 students a year. I'm here to talk to you today a little bit about something that I think is important, which is mental health emergency services. I don't think that I need probably to convince anybody around the table that conventional emergency rooms are challenging places for people that go there primarily for mental health reasons. And in Ontario, about 1 in 8, about 12% of people that go to the emergency department go primarily for a mental health or substance-related problem. As you probably also know, they will typically wait a long time in acute care emergency departments that really were not designed for this kind of an experience, and even in mental health emergency departments. And at the end of the day, as somebody who's worked in acute care emerge and who has worked in specialized mental health emerge, it remains the case that after that period of time waiting, sometimes a very long period of time waiting, really all you're going to get is a disposition. Admit, no admit. And if no admit, a follow-up appointment. And I think that we can do better than that. And a part of that is that a lot of emergency staff really are not trained to deal with mental health difficulties. At Ontario Shores, we've looked around for different kinds of models that may be of benefit to the system. We think we found one that is very unique. It's called the empath model, and I think the acronym is probably on your one-pager, although I don't have a copy of it in front of me, so I'm not sure what's on there. This is a model that's coming out of the United States. There are a number of these units in the United States. There are no such units in Canada. We think it's a wonderful opportunity to test something that ultimately I think could and should be scaled up as a very different way of dealing with things. You'll have a number of hospitals, I think, that will have come to you around mental health emergency services. Many of them are aware of the empath unit. It's a big promise. It's a big commitment, not necessarily financially, but culture change-wise to do an empath model. And I'm not aware of anybody else that's really offered that. There are a number of very unique features to the empath model that I think are worth knowing about. And I can tell you, as somebody who's visited them, I don't think the transposition to Canada is an issue. I've seen these work in very marginalized, very disadvantaged communities in the United States. We visited the first one ever in Oakland, California. I'm not anxious about the fact that it's an American creation. And we remain in touch with people running empath units in a number of different communities in the United States, getting their learnings and helping us to try to prepare to do this. So what's unique about an empath? It's only mental health. First responders are sent home, on average, the promise is, within 20 minutes. The wait times are normally about 2 to 3 hours. The patient is seen immediately by the psychiatrist. The psychiatrist's office is right by the front door. The patient can be there for up to 23 hours and 59 minutes. The patient is actively treated with pharmacotherapy and psychotherapy for those up to 23 hours and 59 minutes. And they're treated in a very unique milieu. And we visited them. We've seen them in action. Excuse me, and you have a picture there. It's an open milieu with recliners, which has a tremendously calming kind of impact a lot of times on these folks. The places we visited have restraint and seclusion rates of less than 1%, which is dramatically less than what you see typically in traditional kinds of emergency departments, where a lot of people are in seclusion or restrained in the hallways of the emergency department. These features, I think, make this kind of setting extremely unique. And I can tell you also that one of the advantages of this space is it has surge capacity. Our proposal is for 32 recliners, but we can scale down to 24 recliners. We could scale up. It's a space with recliners. You add staff, you subtract staff, but you don't have a fixed number of rooms, which makes a lot of sense. We've offered a custom geography. I won't get into details as regards that. There are potential savings. We all know that people talk about savings. They are potential savings. You know, in our region, in the region in which Ontario Shores is, we've seen a very significant increase, a 25% increase over the last number of years in ED visits for mental health and substance use. EDs in this region are very crowded. We can take that load and bring it into the empath unit. We can get police and EMS out much, much more quickly with this kind of a process. And we can produce better outcomes. That we have a number of promises, and one of those promises is provincially, admission rates from an ED for mental health are about 33%. That was my experience at CAMH2. The best units in the United States do 20%. So that's a very significant reduction in the number of admissions. I think the picture tells a great story, and we've seen these units, and they really do look like that. Thank you. Almost done. And the last promise that we also make to you is patient satisfaction. So the promises are 20-minute wait on average for police and EMS, high patient satisfaction, very low restraint and seclusion in a recovery-oriented environment, seen within 20 minutes. And I think if we have the opportunity to showcase this at Ontario Shores, where we have the kind of academic setting and the kinds of staff and the kind of funding model for psychiatry and other professions, and the kind of, relatively speaking, allied health and nursing stability, I think we could do something very unique for Canada and very unique for Ontario. And we're hoping for a planning grant to support that, please, and thank you.
Thank you very much. That concludes the presentations, and we'll start this round of questioning with the official opposition, MPP Fife.
Thank you very much, Chair, and thank you to all presenters. Good to see you again, Nina. You came to committee. Really nice to meet you, Brianna. Big fan of the work of the steelworkers, strong voices for workers across the province. And Phil Klassen, you know, I just want to say to you that mental health and addictions has been one of the heaviest topics that this committee is dealing with. And I think it's partly because things have gotten so bad in this province with mental health. I think the pandemic accelerated or entrenched some of those, you know, deep-seated mental health issues. In Waterloo Region, too many people are going to the emergency room to seek mental health supports. What the feedback that we get, and this is the hospital will tell you as well, is that one, the hospital doesn't necessarily have the capacity or the training of staff to deal effectively with someone who is in crisis. Police have told us we're not the best people to deal with a person who is in crisis, even when they have de-escalation training. The cost of people seeking emergency mental health supports is well documented, right? And you make a very good case. I mean, everyone talks about savings. So we try to talk about the return on investment as New Democrats, because we feel that there are compassionate models of care that can be funded that, one, improve the quality of that experience, but also absolutely save money down the line. The mayor of Kingston was here earlier, and the Ministry of Health told them that, you know, when folks are going to the emergency room, it's $1,600 a visit. So if you look at the money and you do the math, the case is there for the model that you're proposing. I just want to give you an opportunity to, one, either express the urgency as to why this investment needs to happen, and two, why it is a more compassionate and effective model.
Thank you very much. It's fundamentally intended to be a more compassionate model. It's fundamentally intended to give people a safe and comfortable and communal space with active treatment and choice. There are typically laundry facilities, sort of some snack facilities, an outdoor courtyard, those kinds of things, a place to decompress. It's really an emergency department extension of the recovery model of care, which you may or may not have heard of, but a very patient and family or carer-centered model of care. In terms of effective, it's a model that's in about 17, it's growing constantly, you have to stay on top of it, 17 mostly academic health systems in the United States, and it does consistently reduce admission rate. And the savings piece of it is really about reducing admission, because as you know, admission to a mental health facility, time spent in bedded care is a very expensive piece of it. I think, though, the most important part of it is it's an important paradigm change. ED is just admit, no admit, go, no go, those kinds of things, which is not necessarily a bad thing for a rash, or other kinds of physical problems. But I think if you wait for a long, long time and a high level of distress and in a rather chaotic environment, it just feels like that's not the model we should be using anymore. Mm-hmm. I think the model we should be using is a model where we're going to do something for you. Mm-hmm. Now, if people are very low acuity, there is another pathway to an outpatient appointment. In fairness, you're not going to take every level of acuity. We do it by CTAS score. It's the Canadian Triage and Acuity Scale. It's an emergency score that's used. But if you're in the right, and we want the highest acuity patients. We want EMS and police. We want the highest acuity patients because you can deal with the highest acuity patients in this kind of a setting. So I think it's about an important paradigm shift, which involves compassion and economics, I think, both.
And I think your point that it's different pathways to mental health. I mean, if you are triaging those acute cases, you actually are alleviating some of the pressure that's on the system as a whole. As MPPs, I mean, all of us have cases that we're dealing with. In particular for me, a young woman, when you transition from a child into an adult, there's a gap in services there. And when people have enough courage to come forward and ask for assistance, because it takes a lot of bravery, I think, to admit that you're struggling, then that care needs to be available, and it needs to be just in time. Sometimes, otherwise, we lose people. So I think that I'm hopeful that the government certainly has the money to do this. They do. It has to be a priority, I think, in this budget for 2023. But thank you very much for presenting today.
Thank you.
Moving over to Brianna, I mean, you make a really good, no delegation has come before this Finance Committee in this session and said that Bill 124 is helping. Like nobody has. In fact, it's well documented now. It's well researched. The evidence is very clear that Bill 124 is driving experienced, compassionate healthcare workers out of the system. Meanwhile, the government is trying to recruit people into a system that is broken. And the recruitment is actually being hampered by Bill 124 because Bill 124 is making working conditions so untenable and cruel and callous in our healthcare and in our education system. I don't know if you mentioned it, but Bill 28 was really a catalyst time for this province, where labor, came together and said, no, you can't, run roughshod over the rights of people in this province just because you have an agenda. So I just wanted to give you really the last word on how important it is to actually have a government that understands that if you really want to build a strong province, you actually have to be respectful of the workers that are working in that province.
Yeah, no, thank you. In addition to working at Queen's University, I also represented healthcare workers, particularly in long-term care. And I can tell you that the impact of the pandemic and the impact of Bill 124, as well as, I heard the previous speaker talk about agency workers, it has completely demoralized that profession, quite frankly. To know that And if you want to go even deeper, I mean, if you look at the Stout Award, which is the latest award that has set the precedent for negotiations at Hilda going forward, you know, even something like the Stout Award employers are.
Thank you very much. That concludes the
We'll
time
get-
for
we'll
that
get you back
question. We'll now go to the independent, MPP Brady.
Thank you, Chair. Nina, I'm just curious, the non-resident speculation tax that you refer to, just wondering, in this neck of the woods, is there a lot of foreign investment in agricultural land right now? Because I come from a very rural area where we're not seeing that.
Yes, there's actually been witnesses before the committee on Bill 23 that I think the number I heard is they're losing over 300 acres a day of agricultural land in Ontario. That's just the professionals that came forward. Like I don't specialize in agricultural.
Right. So I talk about that 319 acres frequently because my farmers are concerned about that as well. But I just didn't really realize that it was foreign investors who are gobbling up that land. It's not in my neck of the woods. So it's that was just interesting to me.
I could explain the foreign investment portion to you. So the foreign investors they've actually opened offices in Canada, and Blackstone is one of them. They've actually opened an office in Toronto. Blackstone's a global corporation, and that's who has been speculating in Ontario. They had a speculator here from 2014 to 2018 that decided Canada was a good place to speculate, and that is Andrew Lapham, who's married to Caroline Mulrooney. So Blackstone's been here speculating. I guess they could be considered Canadian. They have a Canadian arm, but they are a global corporation. So the finance has, when I got into real estate in 1996, they owned no rental units, like Global Finance didn't own any. And now I've taken inventory of my region. Every high rise in my region is either a luxury condo of some sort, or it is a real estate investment trust. It is the largest player in my region is Starlight, which is Blackstone. Killam Properties, which is another real estate investment trust. Centurion, that's who the new landlords are in Ontario. They've absorbed all our rental stock. Like I've watched it happen. They actually put their signs up on them as they buy them. They've bought them in large blocks.
Thank you for that. Brianna, I'm a big supporter of the steelworkers as well. I have 1,100 of them at the Stelco plant in Nanticoke, so I don't have any questions for you, but sure love the work that's being done by our steelworkers in my riding. Phil, is the 24-hour market, so this empath model, you wouldn't be able to keep them past the 24 hours?
People have played with that number a little bit. We've been in constant contact with Dr. Scott Zeller, an emergency psychiatrist from California, who actually has published on this and was sort of the originator of this. I think you lose some of the impetus for active treatment if you make it longer. Some people have extended it to 48 hours, 72 hours, particularly in neighborhoods that have high levels of substance misuse, where you may just need to keep them a little longer. People have done that. But typically, to make sure that there's a sense of urgency about the treatment, a sense of urgency about using that time, most units will say it's 23 hours and 59 minutes. So go, team.
But that may include a plan for the next day and the next day and the next day.
It may result, of course, it results in a discharge. In 80% of the cases, it should result in improvement, a plan, follow-up, and discharge.
Great, thank you.
Thank you. We go to the government side, MPP Crawford.
Thank you, Chair, and thank you to the presenters today. I guess I'd like to make a few comments before I move to some questions. In terms of Nina, we certainly share your concerns about housing, affordable housing. I think that's really cross-partisan lines, that people understand the concern we have for shortage in housing. I did want to clarify something, however, because you did talk a little bit about Bill 23 and the development charges. The development charges which are reduced in that bill for housing is affordable housing. It's not-for-profit housing. It's rental housing. And we have cross-border support from stakeholders on this. I'll give you an example. We have Habitat for Humanity supporting this legislation. We have the Housing and Homelessness Wood Green Community Services in support of this legislation. I have a quote here from the Cooperative Housing Federation of Canada, and it basically reads, "The commitment to waive development charges for all affordable housing developments will have a tangible and positive impact on the ability to develop new affordable co-op homes in Ontario. We also look forward to engaging with the province in order to reduce the property tax burden on affordable housing providers, including co-ops." So I want you to understand that that's not targeted to people that are building $10 million mansions, but affordable, rental, not-for-profit. We want to give those people the most support we can. So, and we've got a lot of support from those organizations, so I certainly wanted to clarify that for you. With respect to Brianna, thank you for coming in as well. Great to be here in Kingston. I did, certainly want to make a point, though, as well, that when our government did take office in 2018, Ontario was the most indebted sub-sovereign government in the world. That's a fact. So if that's not an urgent situation to deal with, I don't know what is. We also had, I know you're concerned about workers, we had 300,000 manufacturing jobs leave the province in the previous decade. And what our government has put into place is policies that are incenting business to come back to the province, to invest in the province, and that's creating new manufacturing jobs in this province, new jobs, which is both union and non-union jobs. So we're getting great support from many unions because they recognize the growth and the incentives we're putting in place to create a more prosperous province. It's good for workers, it's good for unions, it's good for everybody in the province, and it's going to help pay the bills that we have with education and healthcare. These are critically important services we need to provide for. So I think it's about creating that environment that attracts business. And in my riding, for example, in Oakville, I can tell you that Ford of Canada, which employs thousands of workers, was very close to leaving the country because of high energy costs, tax burden, regulatory issues. We've worked collaboratively with the federal government and incented them to stay to create EV manufacturing jobs right here in the province. So we're excited. We need to incent business to create these opportunities, and I think that's critically important. So I think, Ontario, we have our issues, no doubt about it, whether it's healthcare, and there's certain things we need to do more, and we've been hearing that today, and there's certainly an opioid crisis and a mental health crisis, which I want to ask Phil about. But I think we're certainly moving in a positive direction from the point of view of creating jobs and prosperity for the province to be able to finance the social services that we so dearly need. And to my point now to Phil, I'd like to ask you a little bit about your organization, because obviously you're seeing a growing need for mental health support, and we're seeing that across the province. It's not just here. We've traveled the province. There's no doubt this is a growing problem. We want to be able to help support you. Could you give me some sense on the area that you'd be serving and what has been the trend in the last couple years that you've noticed, particularly since COVID?
Yeah, great questions. So we started this actually pre-pandemic, looking into this, talking to stakeholders, talking to people in the region, because we're a regional and provincial provider. And Durham Regional Police and the EMS, we have the slide deck with their slides in it about the number of mental health act apprehensions and what was happening even pre-pandemic. It was climbing. And the same thing with ED visits for mental health and addictions. And then, as you probably know, immediately as the pandemic stopped, it went down and then is returning to a higher level. We've offered in our proposal a custom geography of 30 minutes drive from our door, if I can put it that way. And the numbers that relate to that and the pressure we could take off the system. Now, of course, success can do things to that. I mean, the EMS and police have said to us, if we're out with, further afield than 30 minutes, have said, if we're out of your hospital within 20 minutes, never mind the 30-minute custom geography. We'll drive to you from a lot farther away than 30 minutes if you can release us in 20. But the proposed custom geography is and of course 30 minutes driving in an urban environment is a bit of a jagged figure, but it's a 30-minute drive at normal speeds.
Yeah. And so how much time is left, Chair?
1.5.
In terms of, you know, your profession, have you seen a lot more incidences of mental health crisis in the last 2 or 3 years?
Yeah, the EDs are so full, and our wait list for inpatient care transfers of patients that acute care has not been able to treat effectively has never been higher. I don't even want to tell you the number. It's never, our outpatient wait list has never been higher. I'll tell you the number, but it's scary. It's 4,000 people, despite all the investments that we've made in ambulatory care. And our wait for inpatient care from EDs and inpatient units in our region has never been
And
higher.
if I understand it correctly, in a simplified format, is it essentially what you're proposing is like an emergency room for mental health crisis?
It's not. There are mental health EDs out there. That's the only mental health. There are a few of those. What we're proposing is something more definitive than disposition. We will help you to get over this crisis, or we're going to bring like CMHAs or other resources in-house. They're going to be installed, you know, in the ED. Partners, OHT partners will be installed. A more definitive period of treatment up to 23 hours and 59 minutes. The average is usually about, 10 to 18 hours. And a warm handoff, which is, I think, very different from acute care, which is wait, a short interview, admit, no admit.
Okay, thank you.
Okay, thank you very much. We'll go to the opposition, MPP Kernahan.
Thank you, Chair, and thank you to all our presenters here today. Thank you, Nina, for coming back to committee and for drawing really important, not only financial implications of the change between 2019 and 2022, but also really speaking truth to power about Bill 23. Despite growing calls from municipalities, AMO, to pause, if not completely withdraw this bill, unfortunately, it's been met with blind ideological adherence to continue this. It reminds me of another bill in the last legislature that was going to incent the creation of more housing, which was to remove rent control completely for buildings created or occupied after November 2018, which did nothing except to destabilize people in their homes. Now, in terms of the waiving of development charges, my question is, if developers are not paying for these, who will be on the hook to pay for roads and services and all the things that are required?
That's the rest of the tax base. So that is what municipalities are so upset about. They're having to raise their taxes significantly to make up for this, for what the developers are not paying. And Bill 23, I was one of the witnesses that was not heard on Bill 23. So I'm very familiar with Bill 23. But developers, so like the mayor of Aurora gave an example that a $1.1 million build in his city would have development charges waived. Like, I don't think that's helping. We are socializing the costs and privatizing the profits.
Absolutely. And if these development charges are removed from developers, will they then pass on this cost savings to purchasers when there's no oversight?
There's absolutely no guarantee, and it doesn't make business sense to do that. It makes sense to sell for the most profit that they can sell it for. The costs, this won't be passed on. The savings will not be passed on.
I also want to thank you for really talking about the non-resident speculation tax and the exemption that, and pointing out directly who benefits from this. It's deeply concerning that we have REITs buying up single-family homes as well as rental properties, and even within Bill 23, there is the allowance to take rental units and turn them into luxury condos. So the official opposition shares your concerns. So thank you. My next questions are going to be for Brianna. You pointed out that in the body of Bill 124, it talks about responsible fiscal management. Do you think it's fiscally prudent for this government to appeal a court decision that they have already lost?
No, I do not. And quite frankly, whatever the situation was in 2018 in terms of an economic crisis, the court has already ruled that situation did not exist in 2019. So it makes no fiscal sense. It is not responsible to challenge legislation that has already been struck down and to further jeopardize working families in Ontario.
I want to also thank you for speaking truth to power. And earlier this morning, we brought up John Snowbelin, who was caught on a hot mic indicating that he was trying to create a crisis in education in order to pave a way for privatization. And that is obviously a concern that we have with healthcare, opening up private clinics to cherry pick the easiest, most lucrative surgeries from the public system, to take already diminished staff from the public hospitals. I wanted to, I was particularly taken by your comments that a large proportion of your bargaining unit are using food banks. What proportion of your folks are having to rely on food banks regularly?
So that was a comment not from my bargaining unit, but from the teaching assistant and the postdoctoral union on campus, which represents graduate students. And that union, PSAC 901, reported that 70% of their membership is currently accessing or has accessed food banks, which is absolutely disgusting.
Most definitely. Food banks were actually created to be a stopgap measure, not something that was regularly used, and yet we see an over-reliance on them. I also want to thank you for pointing out the fiscal mistake of the license plate sticker refund and the money that was spent on that, and also for this committee just to take a look at the 407, one of the greatest transfers of public wealth into private hands, and that there was a $1 billion fee that was owing to the government that they forgave to a multinational corporation throughout the pandemic, which it was also deeply concerning. My next questions are for Phil. Very intriguing model that you've brought forward here for the committee, and you've indicated that it's could potentially realize $10.7 million in annual savings. What is the cost of this program? I'm not sure that I saw it on your handout.
Yeah, the operating cost, I mean, of course, that's partly what a planning grant, I guess, will help us with. But the operating cost, as I recall, is somewhere in the range of between $7 and $10 million, I think, if I remember that correctly.
Excellent. This is part of what could potentially be an excellent continuum of care, really prioritizing mental health and taking that into consideration. If I want to give an example, in my riding, there is what's known as the COAST program. It is a program that is funded by CMHA as well as the London Police Services, where a mental health care practitioner is responding to those mental health calls rather than sending a uniformed officer. But I also think your model, where you're making sure folks are taken care of in a timely fashion, is incredibly important, because the last place people want to be is in a hospital, but you want to make sure that they get the care that they need and deserve. So I want to thank you for bringing this forward today.
Thank you.
Independents, MPP Bowman.
Thank you all for being here today. It's very interesting to hear all of your presentations. I have two questions, one for Brianna and then one for Phil. Brianna, we touched on the workers who are using the food banks, and I guess that is, as I think you said, that's something different right now, and not just for the members who you referred to, but we're seeing a lot of that in the news and hearing from other groups about the, people who are employed, who have jobs going to food banks again. So, to have to rely on that when you are working and have a good paying or even a modest job is something that I think we haven't seen before. Could you talk a little bit more about the impact, what you're hearing in terms of the personal impact to those people who are having to do that for probably the first time in their lives?
Sure. Well, I said in my statement, 12 years ago, I was a graduate student at Queen's, and the funding package remains the same. But what is particularly concerning was the inability of those graduate students to go out and bargain fairly and bargain an agreement that would reflect their true value. I think that many working people in bargaining units and ununionized struggle with the costs of living. We know now that inflation is being driven by corporate profits. Not labor costs, not anything else, it is corporate profits. The impact of that on members who are trying to, buy fresh food. When chicken breast is $35 a package, what are you going to do, right? Interest rates have risen, and people can no longer afford their mortgages. They can't afford rent, and if you can't afford your house and you can't afford food, it doesn't really matter how much money you're making. It is not enough.
Just to clarify, how much has I'll say a typical worker in your union or member, what has their wage gone from 12 years ago when you were working to now?
I don't have that data.
Okay.
But certainly if we look at inflation,
yeah, sure.
All public sector workers are restricted to 1% in total compensation. And what that means is 1% in their wage package, but also in any of their benefit package. So unions couldn't bargain for increased vacation, couldn't bargain increased benefits, couldn't bargain anything. It all had to be contained within that 1%. So there was no offsetting the hurt.
Okay, thank you. Thank you. And I appreciate that. I'm just going to move on because I've only got a limited amount of time. Phil, thank you again for bringing this model forward. I really love the idea of looking around the world and finding innovative ideas and trying them in all sectors. And so I applaud you and your organization for that. And I also think, again, this is something that, so the planning grant would be how much approximately?
I think the request was somewhere between $800,000 and $1 million.
Okay, so call it $1 million. So $1 million to evaluate a new and innovative way to help, not solve, but help the mental health crisis. I think that would be money, very, very well spent. Could you talk about the any other challenges that you might have in actually implementing the module? If you get the grant and then you get the money to proceed, any other potential challenges that you see that you might need help with?
Well, I mean, there are always HHR challenges these days in healthcare, nurse practitioners, physician assistants, nursing staff, et cetera. I think one of the biggest challenges is it's a big model change. You need an organization to pilot this who is ready to really commit to there's no nursing station. The physicians, the social work staff, the peer support, the nurses are in the milieu. You go into interview rooms to have private interviews, to do treatment, those kinds of things. But you're there, you're on all the time. You're diffusing crises, you're preventing control measures, you're taking people aside into a room for psychotherapy or to discuss medication options.
Thank you very much. That concludes the time. We'll go to the government side. MPP Casado.
Thank you, Chair. Thank you to all the presenters here. Nina, I've heard some questions that were asked to you about rent control earlier on, that, as a government, we removed rent control on newly built rentals in the province of Ontario. And we've noticed that the rental starts have been the highest since 91. And you know who in 1991 removed rent control? Bob Rae. So it worked for the NDP. So I think it's going to work for us as well today. As well, on the DC charges that we were talking about, like my colleague said here, we're going to remove them on purpose-built rentals and affordable homes. I have an Indwell project in my riding, and we've been speaking with the Indwell group, and they build only affordable homes, and they charge approximately $560 a month for rent. And they said, with Bill 23, we will be building more of these homes through the province of Ontario. So these are good things that we're doing as a government to stimulate the market so we can build that 1.5 million homes. I noticed you said that we could build 1.5 million homes in a year, and unfortunately, that can never happen. That's what you had said a little bit earlier on, because first of all, we don't have the labor to do that in the province of Ontario, to build that many homes that quickly, but I wish we could. As well, I would like to speak to the United Steelworkers here about the shortage of labor. As you know, that we are going to be the #1 jurisdiction in North America to build electric cars. So, we're going to have to build new plants here in the province. We have to build bridges. How do you see us as a government working together with the steelworkers to get more employees into helping us build the bridges we need, the factories we need?
Well, hire union contractors and you'll have all the labor you need.
Well, do we have... Look at this. I come out of Unifor, so I understand where you're coming from as well. But how do we hire them? Do we have that many people in the province of Ontario to do that?
There is a worker shortage,
Okay.
right? And that worker shortage needs to be addressed through properly funding education. It needs to be addressed through properly funding apprenticeship programs, properly funding universities, which, by the way, are not properly funded. There's no publicly funded universities left in Ontario. And the way to get things built is to attract labor, good unionized labor with high-paying jobs, with great benefits, with health and safety protections. So if you put those measures in place, and if you have a budget which supports workers and their families, I'm sure that you can get all the infrastructure built that you need.
Well, the thing is that right now we have 400,000 available jobs in the province, and we have problems filling them, and that's why we need immigration to come here into Ontario. And not only, once we get the immigration, we need to build the homes too. So it's a whole thing that we have to work together and build together. I'll pass it on to my next colleague here.
Thanks, Chair. For Phil, I'm looking at your proposal here. Just so I understand, you're looking for $5.47 million in annual funding, and is the upfront cost $3.8 million plus $800,000 plus $222,000? They're two separate things. An upfront cost to start up plus $5.47 million annually.
So I didn't keep a copy of that sheet for myself. Apologies. If somebody could lend me a copy, I handed them all over. So it's obviously it's a capital grant. Thank you. Yeah. Okay. Where are we?
I think this is the one you need.
Oh, okay. Yeah. Thank you.
Ontario Shores Mental Health Services requests the Government of Ontario to allocate a planning grant in the amount of $800,000.
Yeah, the other two are quite separate. The other two are quite separate. The GTU.
I'm just trying to get if we're going to make a recommendation on it, I don't want to recommend the wrong amount and not have enough for you on it. Is where I'm going with it.
I'm here only for the planning grant, the $800,000 and change planning grant.
Just the $800,000 planning grant. Okay.
That's it.
And that will be to create the empath model at Ontario Shores.
Yes.
Okay. Understand that. So then the other costs then will be likely next year's budget, the 2024 budget, not the 2023 budget.
The other costs are completely separate, yeah, from what I'm here for. I'm here only to talk to you about the planning grant. That's it.
So one of the other things that you say here is under the benefits that you'll divert 10,000 patients to Ontario Shores, saving $3.6 million. And I heard you talking about it, and the NDP have mentioned a couple of things along this as well, that everybody likes to hear about savings, and those are great things. The reality is, though, there is no savings, because what you would be doing is diverting 10,000 patients who would have gone to a facility that wouldn't have done what those individuals needed. So where I'm going with that is 10,000 people who need a different level of service will get the level of service they need, and 10,000 who need service at a traditional hospital will get that. So effectively, that $3.6 million is helping 20,000 people, not 10,000 people.
Yeah, I think the potential for savings, I mean, you're right, a lot of this is theoretical. It remains theoretical as long as ED visits and ED return visits and hospitalizations continue to rise. If, on the other hand, the model is successful in reducing admissions and reducing ED return visits, as it is in the United States, then what is a theoretical proposition at the front end could become an actual proposition later.
Where I'm trying to go with this is build a stronger case for you. We have hallway healthcare has been for.
There's no hallways in this building.
But we're
We've
going
been
with
listening.
the 10,000 people that are not going to be in another hospital. They're going to be here. There's 10,000 others then who may have been treated in the hallway, may not actually be in the hallway in the hospital anymore because you've opened up a room in the emergency department that
yes.
would have been occupied by somebody who was going there
Yes.
because that was the only place they could go.
Yes.
And you're suggesting that we're going to provide a different avenue that is care where they need it, when they need it.
Yes, you're right. I mean, these people are they're in emergency departments now. We're happy to absorb the increase. The savings are quote unquote theoretical unless and until you have a model that reduces ED pressures and admission pressures and ambulatory pressures.
Well, thank you very much. That concludes the time. Before we start getting all wound up again, and that does conclude the panel and the presenters and the questioning. So we thank the panel for your and the time you've taken to prepare for your presentations and making the presentations here and helping us in our deliberations as we prepare for the next budget. So thank you all. The next panel, while this panel is leaving, the next panel is the Kingston Frontenac Public Library, Ontario Institute for Regenerative Medicine, and the YMCA of Eastern Ontario, and I understand they may not be here. They just came here. Everything is